winning. I spent the last 2 weeks just spinning, trying to work you out is killing. Ever since my heart's been missing.
Good afternoon, Miss. I'm Gwyneth Carlos from BSN2 Mercer, and I'm going to perform the nasal instillation. Nasal instillations are used to treat allergies, sinus infections, and nasal congestion. The nose is normally not a sterile cavity, but because of its connection with the sinuses, medical asepsis should be observed carefully using nasal instillations. Procedure. Step 1 is to gather necessary equipment, which are the tissue, medication with a dropper, gloves, and the medication card. First is check medication order against the original physician's order according to agency policy. This is to clarify any inconsistencies and check patient's chart for allergies. This comparison helps identify errors that may have occurred when orders were prescribed. The physician's order is the legal record of medication orders for each agency. It is also important to know the actions, special nursing considerations, and safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. Consider the appropriateness of the medication for the patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and can also be used to educate the patient. Place medication in a tray or move the medication cart outside of the patient's room to facilitate error-free administration and could save time. Transport this medication to the patient's bedside carefully and keep the medication in sight at all times. So, sir, ano gani ato niya ngalan?
Carl.
Si Carl. Pila ang edad gani, sir? 20. Okay. So, ikaw si Carl and administer na subong sang imong bulong, sir, as prescribed by our doctor. Explain procedure to the patient to gain cooperation and allay anxiety. So, sir, good afternoon. We're going to instill medication through your nose as prescribed by the doctor. Is that okay? Offer tissue to patient and ask patient to blow his or her nose. Sir, we have tissue here. Can you blow your nose first so that the nasal area will be clear? Dali lang. Then another extra tissue in case the patient will sneeze during the procedure. The blowing of the nose clears the nasal mucosa prior to medication administration. Next is to have the patient sit up with head tilted well back. If patient is lying down, tilt the head back over a pillow. So, since our patient is capable of sitting down, we will let him sit. Sir, pwede ka kapungko? Kaya, pungko lang, tapos masandig lang ka to sa sit straight, and then these positions allow the solution to flow well back into the nerves. Do not tilt head if patient has a cervical spine or injury. So for the installation of the medication, the nurse should put, or for optional, the nurse can put gloves on. The next is to draw sufficient solution into dropper for both nerves and do not return excess solution to a stock bottle. So now we're going to instill the medication, but first ask the patient to breathe through the mouth. So sir, pwede ka kaginhawa nga sa baba lang danay kay mabutan tabulong sa imong ilong. Okay, balitang lang tagamay para sige pagid sir. So breathe sa mouth sir ha. Mabutang ko. Riha. So, stay put na na sir sa amo lang ng aside and para mas maano ang bulong. Breathe na na sa mouth. Ano, okay na sir, pwede na taka, ano. Why man kakatol or ano imong nose. Okay lang man sir. Nakaginawa na tarong sa ilong. After instilling the medication to the nasal of the patient, remove gloves and discard. Then perform hand hygiene to deter the spread of microorganisms. Then assist the patient to a comfortable position to ensure the patient's comfort and evaluate the patient's response to the procedure and medication. The patients need to be evaluated for any adverse effects from the medication or procedure. And that will be all. Thank you.